Medical professionals of Reddit, what is the nastiest case you've encountered? Moving an elderly diabetic patient from the stretcher to the bed. Her rotten pinky toe came off during the transfer. She didn't notice. Guy shot himself in the head with a .22. I started doing CPR and his brains kept flowing out of his mouth. Thankfully my acting chief told me I could stop. Source: I'm a firefighter. Holy crap. Guy had laid on his couch for so long that his skin had grown into the fabric. EMS had to cut the entryway of the house off to get the couch out with him in it. They then had to get a U-Haul van to put him in and bring him to the hospital. When he had gotten to the ambulance bay, I was part of the team to get him off the couch and onto a bed. The smell. I will never forget that smell. Just think about how long it would take for your skin to grow into a couch. He had not moved off that couch in months. For anything. His mom was feeding him and he was defecating etc directly into the couch. We finally decided the only way to get him on the bed was to just tip the couch over. Myself and a few nurses were trying to stabilize his necrotic legs. When we started to flip the bed, his left leg completely detached from the knee down. The nurse next to me vomited and I managed to hold the leg in place until we set him down. It was only attached to his knee by the skin and muscles. The bone had snapped just from gravity. All the skin on the back of his legs and back peeled off and stayed on the couch. The smell and watching that leg spin 360 degrees will never leave me. TL. Dr. Guy laid on couch for months and died. Source: MS4. Dated a doctor for 5 years. He was Israeli but worked in a hospital in Palestinian territory right after med school. There was one patient who he noticed on his first day. He was a very old man who'd been there for months. He was in a coma and had an infection that had eaten through one side of his face, exposing his teeth and jaw. Apparently his mouth was always open and he always sounded like he was gasping for air. My BF said he seriously considered just giving the old man a huge dose of something because it was inhumane to keep him alive in that condition. The laws in Israel about euthanasia are very strict and you have to take every measure to keep people alive. But the real reason he didn't do it is because he never got a minute alone with the guy. Realistically, it's good that he didn't, because a coroner with half a brain could have spotted an overdose in an otherwise stable patient and your doctor friend's career would have been over, not to mention possible jail. Paramedic picked up a lady wearing a muumuu to move her to a stair chair. She apparently wasn't wearing underwear and as soon as she was upright she took at least a 3-pound crap all over my boots and legs. Got my partner good too. I managed to only dry heave while carrying her outside where I vomited all over her lawn and in the back of the ambulance for the rest of the drive. Also firefighter. The worst was showing up to a new family's house because the new parents were not paying attention to their 18-month-old's location. Found her that day face down in a kiddie pool you can buy from the dollar store. No amount of medical intervention can prevent that. Jesus, I just flashed back to when we moved into our house and my husband and I both thought the other was watching our 18-month-old son. We started looking for him everywhere. I finally ran out front and saw him standing in the middle of the street about 5 houses down. I must have run that distance in 3 seconds. Scared the crap out of me. I can't imagine how awful that must have been for them. I used to be a radiotherapist. My first job was in a very hot, and in some places lacking in amenities, country. We were told a patient would be coming in, and that we would need to button up our white coats and wear masks not commonly needed. I suppose I should have put the pieces together. In our lovely, shiny, new hospital, an old man with a bandaged foot and lower leg had been causing people to move away because of a rank smell. What did I care? I thought, it's probably just bad BO. Besides, I'm mostly anosmic. He comes in. We lie him down on the bed, face down. I'm a bit confused, as I raise the bed a bit to make moving him and messing with dressings easier. As there has been no treatment plan sent in with him, word was that the oncologist was going to do a visual setup, rather than spending time on the simulator machine. I can still see this now. The nurse starts to unwind the bandage from his calf. I can see others are enjoying the smell of unwashed dude, but I'm sweet. We get down to the nitty gritty. The bandage comes off and we're left looking at his foot with just the dressing pad over it. It looked weird. It was red, but looked spongy. I could see it moving, as if Time slows as the nurse gets hold of the dressing pad and pulls gently. The pad unsticks from the just above the inside point of his heel. His heel gently peels off with it. I know for a fact that everyone in the room would have started looking at each other wide-eyed if the maggots hadn't started dripping out from where the back of his foot had been. They went everywhere. Perfect silence, beyond a voice, possibly mine, saying that getting the doctor would be a good idea. The old dude didn't feel a thing. His foot had been dressed on a Friday, and the flies had got to what was already necrotic before his Monday appointment. He ended up having a below knee amputation. The other one is about malignant melanoma. Let me know if you want to hear about it. I'd love to hear your tales, war stories. Feel free to share. This comes to mind because it was so recent. Elderly demented patient had a rectal tube in place due to C. diff and to prevent further skin breakdown. It was near 2200 and I was doing rounds when I began smelling it. If you have ever smelled C. diff, it is something you will not forget. As I look into the room, this patient is saturated in blood and feces. I have seen my fair amount of blood, but never this amount. The amount to where you walk into the room and immediately begin tasting iron. Come to find out, she had forcefully removed her rectal tube and her platelet count was low to begin with, thus causing massive hemorrhaging upon removal. This was one of the only times I have questioned my occupation. On trauma service during med school, a 22-year-old was brought in with a 7-inch serrated hunting knife through the eye into his brain. CT of his head looked awful. It was hard to recognize normal brain tissue. Posted this in another thread before. Weekend afternoon, one of the first nice days of spring. Slow day in the year for the most part, when in comes a distressed younger couple with their infant baby. Mom is hysterical, and dad is barely keeping it together. Dad gets it out that baby is bleeding from his mouth. I'm skeptical, because the baby looks quite happy, but I do see a slight reddish pink tinge inside his mouth. I take the child and put him down on the exam table, all bright lights and tongue depressors to get a good look in the baby's mouth. Sure enough, evidence of blood, but again, no baby distress. Oh wait, there's something near the back of her mouth. Kind of a darkish red color. A blood clot maybe? Not sure. Have a co-worker firmly immobilize the head, and with hemostats, go in and pluck out the object. Amazingly, it comes out in one piece, and looks like a plump, slightly larger sized raisin. I can't figure out what it is, but it's definitely not a clot. Into the specimen bag goes the squishy thing. No distress for the baby, vitals normal, breathing easily, happy demeanor, good color, etc. Time to get more of a history from mom and dad. First day outside with new baby and their dog, enjoying the weather. Baby's on a blanket, giggling as the dog runs around him. Wait a sec, did you say a dog? Lem take a closer look at the thing in the specimen bag. Sure enough, suspicions confirmed. It's a tick. Deflated to be sure, but a tick that recently had a large meal of the red stuff. Baby must have pulled it off the dog, and then done what babies do by putting it in his mouth. TLDR. Infant pulled a tick off of family dog and chewed it. This is probably the nicest, happiest, most benign story in this thread. It's a breath of fresh air in the middle of a field full of horror. I got to do a week of OR observations as part of my training in sterile processing. I got to see some cool stuff, like joint replacement, brain surgery, including an exploding subdural hematoma hit shot CSF clear across the room, and robotic surgery. But I also saw gin. One case was a vaginal hysterectomy, hard to watch, but enlightening. The next, another vag hysto case, haunted my nightmares for a while. 57-year-old postmenopausal morbidly obese woman. To do a vaginal hysterectomy, they open the vagina up, grab the cervix with a tool called a tenaculum, which looks like a pair of giant earwig pincers, and basically pull the cervix out. Upon pulling it out, it dumped out a foul-smelling, chunky substance which resembled tuna helper. Even the seasoned nurses looked away in horror. To this day, 8 years later, I can't eat tuna noodle casserole without shuddering a bit. The fact that you can still eat tuna or anything astonishes me. Cardiac sonographer here. I was called to the estat. The patient had a kitchen knife sticking out of his chest. It took less than a minute to confirm that yes, his heart was punctured and bleeding into the pericardium, which is the sac that surrounds the heart. He was already in tamponade, which means the heart is drowning in fluid. I've never seen anyone whisked off to war so fast. He survived. Definitely read your username as Tabadaba. I thought that was very appropriate for the story, until I read it again properly. The amount of sexually and physically abused children is astounding. You encounter these kids daily and may never realize it. Kids who try to kill themselves because of bullying. So many stories and each one is horrible no matter the circumstances. Yet, just last week I went to a code where a poor 9-month-old had a cracked skull with internal bleeding and bruising around his neck. That one really got to me. Used to volunteer in an emergency room. This one guy had both his feet severely infected with fungus. While I was wrapping them with a bar and the pus was spilling everywhere. Mine isn't nearly as disturbing as the two top posts, but when I was a CNA working nights at the hospital, we got a call from the saying they were bringing up an admit, but we never got an answer as to why the patient was being admitted. When the transporters showed up with the patient, his legs were wrapped in the wet umbrella bags, obviously. Plastic bags for you to place your wet umbrella when going in somewhere from outside. And when we asked why the patient had these bags taped to his legs, the transporters told us that they were holding in the smell. Of course, we still aren't sure why he has these bags, but we are slowly but surely getting somewhere. When evaluating the patient, we, my charge nurse, the patient's nurse, and myself, took the bags off and the smell was like nothing I can describe. Come to find out, the patient lived alone by himself and rarely showered. He had developed gangrene on his feet, and it was so bad that his skin was literally falling off of the bone. The smell was rotting flesh. He went in for immediate double amputation the next morning. And by next morning, I mean, he was brought to the floor at 4 AM, and was down in ore by 8 AM. A customer of mine, who works as a nurse at a correctional facility, told me about a woman that was reaching up inside of vagina, pulling out flesh and eating it. She said that the head of security at the time couldn't stop throwing up and had to leave. They had to call in a backup captain to take care of the situation. Had a patient come in labor, could smell her BV, bacterial vaginosis, infection from the door. As labor progressed, there were white chunks of nasty literally falling out of her. We obviously already had a bed saved for the baby in the NICU. Showtime finally came, and to this day I don't know how the doctor didn't throw up with his hair down there. Anyway, baby came out, obviously sick. We washed that kid 3 times, and he still smelled awful. I walked into NICU later that day and gagged on the smell. How you can have an infection like that and not get it treated I will never know. How you can have an infection like that and not get it treated I will never know. Probably an American. Probably no health insurance. Psychiatrist here. I don't frick around with eating disorders for a second. When I suspect eating disorder, I get a full set of labs to make sure they are safe and have a low threshold to referring to specialty clinics. I've seen some severely malnourished people. I mean, think Holocaust survivor. But what makes it tricky is patients with eating disorders who either are in denial about their eating disorder or flat out don't want it treated. Sometimes there can be a delusional feel to the disorder where they are convinced that either nothing is wrong or if they realize they're underweight they blame it on medical problems or pain rather than admit to an eating disorder. TL. DR. Lady lost bottle top up her vagina for months causing persistent infections and a massive outflow of dried period blood, bacteria, and pus when removed, sufficient to gag everyone present. Describe it with far too vivid imagery to rake in thousands of internet points. EMT, bedridden 98-year-old lady with Kennedy ulcers to the bone nasty infection. When we came in she was laying on her side and the cat was licking her ulcer. This one just happened 2 days ago. Lucky I wasn't around when this happened. Little old man has dementia. Little old man has C. diff. He is a brand new admit to the facility due to the last facility discharging him due to behaviors. None of this was reported to facility. He approached me while I was on shift with agitated discussions over car keys and getting out of this place. Nursing home. I realized he was probably more confused than our average patient, but census is low and they don't have an Alzheimer's unit available. I redirect him and see my patient and go home. I look for him next day for therapy evals. He's not there. I approach my other patients and quickly hear the story. He began by screaming for help at 10 at night. They helped him use his private bathroom, C. diff isolation precautions. He is still very awake and agitated. He yells and screams for a bit, then they put him in his wheelchair to let him stay mobile. Big mistake. He begins his reign of terror by going to both shower rooms and crapping in each, effectively shutting them down until decontamination. With those two down, he begins sneaking into residents' bathrooms and defecating everywhere. Into their toilets, closets, one poor lady's trash can next to her bed. But he's not done. Can staff haven't realized the chaos of this determined individual because he transfers himself out of his chair and back to bed. He then grabs a hold of the urinary catheter with both hands. He rips it out like a lawnmower starting, blood and crap covered. He begins to realize that wasn't meant to be removed that way. He screams for help. Staff arrives to chaos on the hall. They have to call the ambulance. The EMS team quickly refuses the patient when they see him covered with highly infectious waste. He is then life-flighted out of facility due to pain and bleeding. I know this is sick, and likely a coping mechanism, but as a doctor, reading this story right now makes me literally LOL. In my first year of medical school, I wandered down to the ER one Saturday night. In gangland, apparently it's a common initiation to be made to shoot a homeless man. This poor old homeless guy who'd been wheeling around in a wheelchair with a hip to foot cast on was shot in the head with a flare gun that had been loaded with a shot shell. Avulsed most of his left face, but the eyeball was spared and the skull wasn't violated. Just a lot of bloody shreds hanging off. During the exam it was evident, though, that there was gangrenous skin around the top and bottom of the leg cast, so the trauma surgeon called for shears. He cut the cast open but it did not come away easily, so he called for help. I and a few others grabbed the cut edge with gloved hands and on his order, pulled the cast apart. Most of his leg came away with the cast. The reeking stench of gas gangrene struck me like a hammer and produced instant, reflexive vomiting. I had time to turn my head and hit the lid of a hazardous waste can. Two other people also reflexively puked, one landing her greenish chunks right into the just opened cast. Inside the cast, I recall seeing muscle, ligaments, most of the femur including the cartilage covered part that articulates with the knee, and maggots. There was little blood, probably because the leg was gangrenous and dead. The homeless man screamed as the cast came off, but the screams grew feeble rather quickly. I think he was dying. I noped out of there right away, although we didn't have that phrase back then. I left the ER, walked to the parking lot, drove to my girlfriend's house, got in bed with her and cried for about an hour. The next morning I woke up and decided that I was going to have to alter my ways of perceiving and thinking if I was going to do this. Over the next couple months I sought out medical horrors, no shortage of them in this giant inner city public hospital, and systematically desensitized myself to them. Nothing troubles me along those lines now, and I have never seen anything anywhere near as awful. Showed up on a lady who had been sitting on the street. She had shot going down both legs with larvae living in open wounds. The smell still haunts me. As only a student in the medical field, I have seen a lot of stuff. For me the most disgusting to be around is C. diff, crap everywhere. And that distinct C. diff smell that permeates the hallways. Not a doctor, but my dad is an anesthesiologist. Had 2 separate occasions of heads who got loaded and ate all their fingers off. I've been hospitalized quite a few times now. I just want to say the crap that nurses and doctors go through on a daily basis is freaking mind-blowing. Nurses deserve like 5 times what they're currently paid. And docs, well, just keep doing what you're doing. Anytime I've been an inpatient there has been non-stop crapping on the floor, screaming, crying, other bodily fluids everywhere, people dying, violent senile old people literally covered in crap running around. I almost had a nervous breakdown last time I was in there. As a 30-year-old male, I'm not ashamed to say that after 2 weeks in hospital, I cried myself to sleep while basically hiding under the covers because of the traumatizing mayhem happening all around me. If you know a nurse, give them a hug, and maybe some money. Hey man, Hospitals can be scary places, especially when you're alone. No shame in tears. Hope you're doing better. This is from medical school years ago. A woman sat her 3-year-old girl in a pot of water up to the nipple line and boiled her. I saw the kid a few months after. She was completely scarred up. The burn had caused liver damage and she needed a liver transplant. I still don't really know the mechanism of this. They had a foster mother lined up for her, and she was looking forward to adopting her. Unfortunately, I think I remember later being told that the child died. It was the most senseless, horrific thing I've ever seen. I worked with a similar child. As a baby toddler, one of his parents had put him in a bath of scalding water. This kid had the most horrific burns all over his body, and had difficulty walking because of it. It was heartbreaking. I think the single nastiest thing I have encountered in my career is the smell of extensive, malignant cancer. During my end surgery rotation during medical school, I had a patient with uncontrolled squamous cell carcinoma on his left jaw that had progressed to the point that there was a huge crater of cancer and necrotic tissue. A fellow med student saw him first and after interviewing him, came out to present his case to the attending. He was clearly shocked, and when it came time to present his plan, he pretty much just said, "It's really bad." So we head toward the exam room, and as we turn down the hall where the room is, the smell first hits me. It was hard to describe exactly how bad this smell was, but imagine a combination of a dead animal that had been rotting for several weeks, combined with a bag of hot garbage. We opened the door and are hit with the smell full force, enough to the point I had to actively stop myself from gagging. The patient's mandible and oral cavity were clearly visible through the crater, and there were numerous metastases spread throughout his neck and upper chest. The outer ring of the crater was very raised and angry looking, clearly an aggressive cancer, and the inner area was a combination of black dead tissue and pus. I was amazed that my attending was able to handle the situation professionally, although all we could offer him was a referral to hospice care and pain medications to manage the severe pain. We were working in a state where physician-assisted suicide is not yet legal. Regardless, the combination smell of dead tissue with actively growing cancer was something I will never forget. Source: physician. On my uncle's first day working in accident and emergency, someone handed him a motorbike helmet of a guy who had been in a bad accident. The entire head was still inside the helmet. He quit on the spot and became a concert pianist instead. Not a doctor, but my friend GF, who is one, once started a convo saying, "I saw the biggest penis today." One of her patients had a massive swollen dong because he was a truck driver with diabetes. Holding his pee in led to bacteria going crazy over all the sugar in his pee. This a side effect of the new diabetes drug Invokana. Not the swollen dong, but frequent infections from the sugar in the urine. Double-edged sword it is. A friend of mine recently posted this on another forum. So who here has ever smelled two gangrenous legs that have gotten that way because someone decided to spend 25 years crapping and pee themselves and not changing their trousers? He's fully able. Just had a nervous breakdown and started crapping himself. And it goes into the wounds. The floors are hardened into his skin and the trousers. Can't force him to go to the hospital though, because he's fully aware of what he's doing and the consequences. That's like the worst case of passive lengthy suicide I've ever heard of. Jesus. I am not a medical professional, but the nastiest I heard from a doctor friend is a catastrophic combination of issues that I don't pretend to understand in the colon and intestines, which resulted in the patient vomiting her own crap. I never believed it, but I'm not a doctor, so what do I know? Not me, but my grandmother, who's a doctor. She told me someone once came in with a beetle up their nose and left it up there a week before coming to her. She told me once she got it out, tons of snot and blood came pouring out. Worked in dietary at a nursing home. I had to deliver to a room that had the note skin tear risk. When the nurse went to lift the woman, she shifted slightly and an inch of skin literally just split. Neither medical professional or a case I encountered, but my mate's mum is a nurse and she regaled us with a lovely story of a man coming into A&E with an IKEA pencil shoved up his dong. My dad is a doctor. During his residency, a patient came in complaining of a bad odor coming from her lady region. She had her first period a few months prior. Turned out she thought tampons were dissolvable. I work in surgery. One day I go to pick up a patient from pre-op for a craniotomy. This is no big deal. We do this surgery all the time. Only with this patient, I can smell something bad before I even pull back the curtain. This is never a good sign. I go in, and his head is all wrapped up in gauze. From the top of his head to about midway down his face. One of his eyes is uncovered. He's fully responsive and oriented, so I ask him the normal questions and we get rolling back to the room. During intubation I get the background on what happened to this guy. Apparently he had skin cancer that he never got treated, and it began to eat inward. It comes to time for me to prep the site, and I unwrap his face, and literally half of his face is eating away. His left eye and the surrounding bone is completely gone, and the eyebrow has fallen into the area where his eye used to be. The skin in the forehead area is gone, and so is the skull under it. I can literally see into the brain, where infection has set up, and I'm watching pus drain out with every heartbeat. Every time I go to prep it, my sponge comes back covered in pus and grey matter. We eventually ended up setting him up with a plate to cover the part of the skull that is missing, and I think went with a skin graft to cover the forehead area. TLDR. Guy doesn't get face cancer treated. It eats away his eye and into his brain. Wear sunscreen, people. As a medical student I got to scrub into a case of severe Fernie's gangrene. This is a severe infection that affects the scrotum and surrounding soft tissues. It often spread quickly and can become life-threatening. At first it did not seem too bad. In the grand scheme of things, it looked we would just be removing the skin around the scrotum only. What we discovered was that it was far more extensive than expected. We would have to remove the skin and soft tissue from the just below the belly button to the midway down the thighs, the perineum, and most of the buttocks. The skin around the penis was removed as well, and the testicles just dangled from their cords, like one of those Office kinetic motion toys, but with 2 balls instead of 5. I am now imagining a quiet hospital room at night. In the room, a single patient dozes, the entire midsection of his body swathed in bandages. Intravenous antibiotics and other fluids drip slowly into him. There is little noise from outside or adjacent rooms. Upon entering the room, one hears only click 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 click. I work in the laboratory as a lab scientist. I had to cut into a swollen, infected gangrenous scrotum. The squishy sound it made, the juice that came out, never eating anything crunchy and juicy at the same time. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.